Tonight on You Paid For It, those focused on COVID vaccinations in the minority and underserved communities say there's still a long way to go to make the most impact on those areas. They say while the mass vaccinations are having an impact, there's still shortcomings that are leaving out way too many people. Here's tonight's You Paid For It. Missouri finally seems to be getting around to trying to get as many vaccines as possible to African American, Latino, immigrant, and other minority communities using mass vaccinations and other events. Experts admit it's surprising it's just happening now, considering African Americans, for example, were contracting COVID and dying from it at a rate of 3 and 4 to 1. Affinia Healthcare is focused on the Black and underserved communities of North St. Louis, North County, and poor areas of South St. Louis. They vaccinated 9,000 people so far in this pandemic, going to churches and other places in the community where the people are. I talked to Affinia's Senior Vice President, Dr. Kendra Holmes.
Have the mass vaccination events been effective?
I think to a certain extent that they definitely have been effective. We've seen an increase in the number of individuals who have been vaccinated. But back to those barriers, a lot of elderly individuals who may not have access to transportation aren't able to, to meet the needs.
One of the mass vaccination events here was expecting some 3,000 people. They got 700.
Again, I think when you're looking at mass vaccination events, they seem to be very effective in rural communities, but maybe not so much in urban communities.
Dr. Holmes talks about the challenges of urban poor communities.
Their household living status, their employment status, being essential workers and not having the ability to, work from home. Individuals who are essential workers don't necessarily have the ability to stand in line at a mass vaccination event for hours. They have work commitments, they have child care commitments. So that's a barrier. And transportation, again, we're seeing is a huge barrier. And again, just access to making that appointment.
She admits often governments have been too slow to take a focused approach to combating the pandemic. She warns that's hurt everyone.
Minority communities were suffering COVID, the worst impacts of the effects of COVID. Shouldn't we have zeroed in on those first with the massive effort?
Absolutely. Absolutely. That should have been the focus. Again, I've mentioned this before. Individuals don't live in silos. Individuals who live in North St. Louis City still go to West County. They still go to South County and St. Charles. So it's not like you're going to isolate these individuals to one community. What happens to the underserved impacts the entire region. And that's why it needs to be a priority.
Now, some of those who had first focused mainly on the mass vaccination events as the answer are actually reaching out more to underserved communities to try and go out in the community to meet people where they live. I will, of course, continue to stay on top of this critically important issue. After all, you paid for it.